Most people think nerve damage happens suddenly, but doctors warn that it often starts quietly. A silent poison enters the body every day. You do not feel it at first. No pain, no alarm. But inside, your nerves slowly begin to break down. This damage builds over time, and by the time symptoms appear, it is often too late. The most dangerous part? Millions of people are exposed to this poison without even knowing it. Your nerves are like tiny electric wires inside your body. They carry messages from your brain to your muscles, skin, and organs. They help you feel pain, heat, cold, and touch. They also help your muscles move and stay strong. When nerves are healthy, these signals move fast and smoothly. But when nerves are damaged, the signals become weak or confused. This is why nerve damage is serious. It does not just cause pain. It can affect movement, balance, and daily life. Over time, damaged nerves may stop working completely. Doctors call this condition neuropathy. In simple words, neuropathy means sick or dying nerves. It often starts slowly. At first, it feels small and harmless, but nerve damage does not heal easily. Once nerves are badly damaged, recovery is very difficult. That is why early awareness matters. Ignoring nerve health can lead to lifelong problems that medicine cannot fully fix. Doctors warn about a poison that harms nerves quietly. It does not cause sudden pain. It does not make you collapse. That is why it is called silent. This poison enters the body in small amounts, sometimes through daily habits, sometimes through common products or long-term use of certain substances. You do not feel anything at first. No warning signs appear early. The poison slowly builds up inside the body, day after day, month after month, year after year. As exposure continues, it begins to disturb nerve cells. But because the damage is slow, people never connect the symptoms to the cause. They blame age, they blame stress, they blame weakness. That is the danger. Long-term exposure keeps damaging nerves quietly. By the time the poison is suspected, the nerves are already suffering. This poison does not attack all at once. It works slowly and patiently. First, it irritates the outer layer of nerve cells. Then it interferes with how nerves send signals. Messages from the brain become weak. Signals travel slower than normal. Over time, the nerve's protective coating begins to break down. This coating is important. It keeps nerve signals strong and clear. When it is damaged, nerves start to misfire. Some signals stop completely. Others send false pain messages. This is why people feel burning or tingling for no clear reason. As exposure continues, nerve cells lose energy. They cannot repair themselves. Slowly, the nerves begin to shrink and die. This damage is hidden. No bleeding, no visible injury. But deep inside, the nervous system is quietly breaking down. Nerve damage rarely starts with severe pain. It starts with small signals. A light tingling in the feet, a burning feeling in the hands, occasional numbness, mild weakness. People often ignore these signs. They think it is nothing serious. They blame tiredness or poor circulation. Some think they slept in a wrong position. Others believe it will go away on its own. That is a dangerous mistake. These early signs are warnings from your nerves. They are asking for help. But because the symptoms come and go, people delay action. Weeks turn into months. Months turn into years. During this time, nerve damage continues silently. By the time symptoms become constant, damage is often advanced. Doctors say this delay is one of the biggest reasons neuropathy becomes permanent. Some people face higher risk than others. This includes people with certain daily habits. Long-term exposure to harmful substances increases danger. Poor nutrition can weaken nerve repair. Certain lifestyles place more stress on the nervous system. People who ignore early symptoms are also at risk. So are those who self-medicate for long periods. Age can increase vulnerability, but young people are not safe. The silent poison does not choose by age. It targets exposure and time. People who think this cannot happen to me are often the most exposed. Doctors stress this is not about blame. It is about awareness. Many people are unaware they are harming their nerves. Understanding risk helps prevent damage. Ignoring risk allows the poison to keep working silently inside the body. Doctors are seeing more nerve damage cases every year. Neuropathy is no longer rare. The biggest concern is late diagnosis. Most patients come when damage is already severe. At that stage, full recovery is unlikely. Nerve cells do not heal like skin or muscle. Once destroyed, many cannot be replaced. Doctors also worry because symptoms are often misunderstood. People treat pain but ignore the cause. This allows damage to continue. Medical experts warn that early action could prevent many cases, but lack of awareness delays help. That is why doctors speak out. They want people to recognize silent danger. They want nerve health taken seriously. Because once nerve damage becomes permanent, treatment options become limited. The answer depends on timing. Early action can slow or stop further damage. The first step is removing the source of exposure. Without that, treatment will not work. Medical guidance is critical. Doctors can identify causes and protect remaining nerves. In early stages, nerves may recover partially, but there are no miracle cures. Anyone promising instant healing is misleading. Honest treatment focuses on prevention and control. The goal is to save healthy nerves before they are damaged. This is why early symptoms should never be ignored. Waiting reduces options. Acting early increases hope. Doctors stress realism, not fear. Understanding limits helps people make better health choices. Prevention starts with awareness. Fear is not needed. Small changes can protect nerves. Pay attention to daily habits. Be cautious with long-term use of substances. Check labels and warnings. Support nerve health through proper nutrition. Listen to your body. Do not ignore unusual sensations. Early medical advice can make a big difference. Prevention is easier than treatment. Protecting nerves today prevents suffering tomorrow. Doctors encourage regular checkups for those at risk. Simple awareness can save years of pain and disability. This message is about awareness, not panic. If this information helped you, share it with others. Someone you know may need this warning. Knowledge can protect health. Stay informed. Stay aware. And if you want more clear, honest health education, consider subscribing. Small steps today can protect your nerves for life.